The second segment of the Nightly News is brought to you by Labrie Credit Union. Labrie Credit Union. We are not a bank. We are better.
On Friday, 17 September, regional trade unions representing former employees of the cash-strapped regional airline Liat rejected the latest offer presented by Caribbean shareholder governments to meet their financial obligations to the laid-off workers. The Secretary General of the National Workers Union, Johan Harewood, says that the proposed draft does not sufficiently satisfy the interests of the workers.
Liat laid off an estimated 90% of its staff last year amidst the COVID-19 pandemic as part of a restructuring exercise. The airline did resume operations, but on a much smaller scale. This restructuring process ultimately left workers seeking compensation that is legally owed to them by Liat. On Friday, 17 September, trade unions across the region deliberated on the draft proposal submitted to the unions for consideration. Secretary General of the National Workers Union, Johan Harewood, speaks about the consultation process between the regional unions, which resulted in the rejection of the proposal presented.
The regional unions met on Friday last week to discuss and deliberate on the draft proposal that was submitted to the unions for consideration. That draft proposal presented a scenario or set of scenarios dealing with the establishment of a compassionate fund to settle the severance payment and the severance payment alone for dismissed Liat workers. So when the entire thing was discussed and deliberated, it was felt unanimously that the proposal was not in the best interest of the workers.
Harewood insists that workers should obtain full compensation and that the goal of the regional trade unions is to ensure that this is achieved.
Our efforts should be geared towards advocating and advancing the position of 100% terminal benefits, which is severance, vacation, and every other outstanding entitlement that is owed legally to the employees by the company. So the draft proposal that was sent strictly dealt with severance pay, but there are several other things that are outstanding and owing to these workers that we felt that proposal was not in their best interest.
A formal joint statement detailing the position of the regional trade unions will be presented to Caribbean shareholder governments. Reporting for the Hot 7 Nightly News, I am Karim Nelson.
Many Christians have taken the stance that they will not be receiving the COVID-19 vaccine as it contradicts their religious belief. They continue to cite the mark of the beast and the end of times as arguments to not get vaccinated. The Christian Council once again is appealing to its members and other Christians to desist from using this excuse. The chairman of the Christian Council calls on all to use the discernment that God has given them to make better informed decisions. He encourages all those who are able to get vaccinated to do so to aid in the return to life as normal.
Let me just say that God uses the ability of persons He has created to provide solutions for problems, and that God gives us means and ways to deal with issues. The fact that He's given to us scientists is part of His solution to a number of our problems.
The Anglican Church has distanced itself from those using religion as a reason why they are opting not to take the COVID-19 vaccine. The chairman of the Christian Council and Archdeacon of the Anglican Church, Christian Glasgow, was one of the early religious leaders who openly took the jab. However, as anti-vaccine sentiments continue to grow, Glasgow is addressing the issue once more. He says individuals who refer to the mark of the beast as referenced in the Bible are simply misinterpreting scripture.
The mark of the beast comes out in the book of the Revelation, which is apocalyptic writing. One of the features of apocalyptic writing is what we call soterical language, where you use secrets and signs. And it is only the person who is of the particular persuasion can understand the signs used. In the book of Revelation, this is a message to Christians who were being persecuted in Rome at that time. The signs used of the mark of the beast 666 pointed specifically to a particular Roman ruler. And so when that secret language, as it were, was used by the author, the listeners, the Christian listeners, understood exactly who he was speaking about. That does not transcend 2,000 years down the road.
Meanwhile, the Vice Chairman of the Christian Council, Major Derek Michel, is echoing the sentiments of Glasgow, relaying the many instances where the mark of the beast's narrative has been used.
When we were kids, we got our first vaccination for polio, against polio, stuff like that. Because each child was associated with a number for their case file, it was said that your polio vaccination was the mark of the beast. And I remember growing up as a teenager in Jamaica when I got my first bank card. They told me that that card with that number is the mark of the beast. And even coming out to St. Lucia, where now I have a credit card and things like that, people say, well, the credit card would have been the mark of the beast. Now we're being told that you getting a vaccination that might actually save your life is the mark of the beast. It doesn't hold water. And I'm appealing to all our fellow Lucians to think about these things. Also, I have to point out that you cannot be quoting and feeding into information from persons who have no knowledge.
Glasgow is challenging all who use the Bible as a reason not to take the vaccine to provide concrete evidence in terms of text as to where the Bible has condemned vaccines. He also advises that the public listen to the professionals as they are making use of the talents that God has given them to lead the nation through such turbulent times.
I think anybody who's using that need to point it out to me, where in Scripture that is, instead of simply regurgitating what they may have heard or what they feel they want to talk about. We need to speak factually about issues relative to this whole situation of receiving a vaccine or not receiving a vaccine. Carefully analyze what you're reading and hearing. God has given all of us a brain. Use it to separate friction from non-fiction.
Reporting for Hot 7 News, I am Genevieve Gonzague.
The special education sector is benefiting from an array of assistive devices and materials, which will facilitate and enhance the instructional process and support systems for special learners on the island. Chris Sackney has more in this report.
Educational services to the population of special school learners require alternative resources and inputs to effect adequate learning and learner development, as the services required are significantly different from that of the general student population. Differences exist in the functional abilities of students, their impairment status, and the curriculum to be accessed. The assistive devices handed over at a ceremony held Monday, according to Education Officer for Special Education Dale Sergis, will assist special education centers on the island in addressing issues including student assessment for special education needs, student mobility, hearing impairment, speech impairments, disorders along the autism spectrum, accessibility to learning resources, rehabilitation of impaired functions, and the ability to better control and interact with their human and physical environment.
So they need stimulation, they need therapy, they need sensory regulation. These are not issues that can be resolved by a teacher standing in front of a classroom or by a laptop and a screen. So it is very important for us that we have these devices to support the targeted needs of these children.
The assistive devices were supplied by the Education Quality Improvement Project, EQUIP, of the Department of Education, Innovation and Vocational Training, with support from the Caribbean Development Bank. Project coordinator of EQUIP, Mary Grace O'Gee, says the idea to procure the assistive devices came from a fact-finding mission undertaken in 2019 at 2 special ed centers in Trinidad and Tobago by special education personnel to witness firsthand the practices that made those 2 facilities successful at providing care to their TNT clientele with special needs.
The collective objective was to observe and to assess facilities, programs, services, and to select best practices that could be assimilated into or adapted to the St. Lucian context. in the interest of developing an education sector that is more inclusive of special needs education, and that is student-focused.
The special education sector has applauded the efforts of the equipped team in not just providing the assistive devices, but to develop a pilot project that will test the use of the devices at 2 local institutions, which provide support to children with special needs.
It's wonderful to give everyone the same thing, but that does not necessarily scratch where it itches. And so what EQUIP is doing is really putting the fingernails where the itches are and giving us that satisfying scratch, ensuring that our children with special needs have their unique and targeted needs addressed.
Chief Education Officer Cyrus Sipal says government is steadfastly committed to the transformation of St. Lucia's education sector so that it is more inclusive and responsive to the needs of students, teachers, parents, and the wider society.
We at Education, we will continue to support the holistic development of every child. And when I say every child, I mean those who need the attention and those probably who are already excelling and they just need now that extra support that they will continue to excel. There is a philosophy that I subscribe to very much. If the child does not learn the way that you are teaching him or her, teach him or her the way that he or she will learn. And this is what we are seeing here.
The pilot phase of the project will be undertaken at 2 special needs centers, including the Lady Gordon Opportunity Center and the Soufriere Special Ed Center. From the Communications Unit of the Ministry of Education, Sustainable Development, Innovation, Science, Technology and Vocational Training, I am Chris Satney reporting.
Authorities are seeking to address the challenges being faced by the island's healthcare system as the country continues to deal with this current COVID-19 wave. On Tuesday, the medical director of the island's lone respiratory hospital shed light on some of the actions being taken to alleviate the burden on healthcare workers. The Ministry of Health, Wellness and Elderly Affairs has been responding to the surge in COVID-19 cases associated with the 4th wave, which commenced on July 25th. Though routine services continue to be delivered, the current COVID-19 situation has placed severe pressure on the already limited staff complement. Additionally, facilities have been severely impacted given that some staff members have periodically been placed in quarantine or isolation. Of critical importance is the state of the respiratory hospital, which has been designated for COVID-19 patients. Medical Director Dr. Alicia Eugene Ford gave a status update on the capacity and admissions to the facility.
The respiratory hospital has a bed capacity of 123, which can be ramped up to 127. Since we started vaccination from February 1st, 2021 to September 20th, 2021, we have had 1,623 admissions, out of which 23 were fully vaccinated and 34 with first dose. It must be highlighted that the majority of the vaccinated patients had milder symptoms when compared to the unvaccinated patients. From June, we had 136 admissions. In July and August, we had 142 and 261 admissions, respectively. As of September 20th, 2021, we have had 234 patients, a total of 773 admissions.
The hospital has sought ways to deal with some of the challenges faced by employing assistance from other stakeholders.
Lack of specialty human resource, physicians such as ICU and A&E specialists, nurses such as ICU and nephrology services. We have recruited staff through the Cuban bilateral agreement, as well as requested through diplomatic channels such as the Embassy of France. A second challenge is technological and communication issues. Flow is currently upgrading the telecommunication system. We have enhanced internal and external communication between administration, clinical team, and patients' families. A third challenge is increased patient flow in the accident and emergency department. But we have received additional support, extending to an annex with a 7-bed capacity.
Another issue is an increased demand for medical gas.
We have a semi-automated system which feeds ICU and our high dependency unit. We have dedicated teams assigned to manage and monitor the medical gas system, and regular training and debriefing, forecasting of the medical gas system consumption. Another challenge for us is the staff burnout and stress. So we do have counseling and debriefing services, empowerment and motivation from management, and a more conducive working environment with a staff lounge with tea corners and staff meals.
Services within the community have also been scaled down for an initial period of 2 weeks as the Ministry of Health seeks to improve its efficiency and delivery of care to patients. For the Hot 7 News, Nisha Charles reporting. More than 675,000 people in the United States have died from COVID-19, according to the Johns Hopkins University. That surpasses the estimated U.S. death toll from the 1918 flu pandemic, the deadliest pandemic of the 20th century. In this CNN report, Dr. Sanjay Gupta explains exactly why so many people are dying this time around.
A little more than a century ago, an influenza pandemic ravaged America.
There were 4 waves of the 1918-1919 pandemic. The 2 greatest occurred in the fall of 1918 and the winter of 1919.
Dr. Howard Markel has studied epidemics in American history.
This was an era where there were no medications, there were no vaccines for influenza. We didn't even know it was caused by a virus.
Best projections, 675,000 people died. Fast forward to today, a grim milestone. Deaths from the coronavirus pandemic have surpassed that figure. More than 675,000 people have now died of COVID-19 in the United States.
Just sadness because it didn't have to be this high.
It is true that back in 1918, the population was a third of what it is today. But that entire population was at the mercy of the pandemic because there were no vaccines. But today, a different problem in the United States, a reluctance to use the vaccines, the very tool our ancestors wish they had had.
It's the unvaccinated that are driving this present surge that's resulting in many hospitalizations, need for intensive care unit, and also the record number of deaths that we're seeing.
We have had some capacity open up. And it is not because these patients are miraculously getting better and going home. It's because they're dying.
Federal health officials now say we're in a pandemic of the unvaccinated.
When 99% of the people who are dying of COVID today don't have a vaccine, that's perfect proof that you need to be vaccinated.
It all raises an uncomfortable question. What are we willing to accept when it comes to deaths? This is the death toll over time so far. 1,000 in March of 2020, 300,000 by the end of last year, twice that many by this summer. Some now ask, could there be 1 million tragic deaths before this is all over?
I certainly hope not. I hope not. I don't believe at all that is something that is an inevitability by any means. If we get the overwhelming proportion of our population vaccinated, we're not going to see that at all.
But that means getting most of some 70 million eligible adults vaccinated, an effort that's been poisoned by politics and misinformation, the worst it has been in 100 years.
It's never been this level of anger and politicization and distrust.
2021 isn't 1918. They lack the science to prevent 675,000 deaths, whereas we, to a great extent, have lacked the will. Dr. Sanjay Gupta, CNN, reporting.
And this is the Hot 7 TV Nightly News. There's more after the break.
The second segment of the Nightly News was brought to you by Labrie Credit Union. Labrie Credit Union. We are not a bank. We are better.